Okay, good evening, everyone. Yeah. Okay, good evening, everyone. Sure. Yeah. Okay, good evening, everyone. So once again, good evening, and welcome to the session of DocTutorials. It's about the ENT doubt solving session. So please confirm in the chat box. First of all, are you with me? Are you are able to hear me? See the screen? Everything is okay? Please come in the chat box with me. It's about this session is actually to clarify your doubts. If you have any question about any topic or any MCQ you have found confusing and you're not able to make up your mind, okay, fine. Perfect. Perfect. Wonderful. Sure. So, first of all, this session is for NEET PG FMG both. And the now keep writing in the chat box one by one any doubtful question in your mind. I hope all of you are doing well. I hope all of you are preparing well for examination, NEET PG, FMG, whichever exam you're preparing. I hope आप अच्छे prepare कर रहे हो. कोई भी doubt ENT को लेके है, any doubt you have, you're most welcome to write in the chat box. I'll be able to, yeah. चलो मैं एक one question I would like to take. I think सबकी दुखती रग होती है वो question. ये water view, cardwell view, कहाँ पे क्या आंसर लगाना है, where to find right which answer. It's a very common question in NEET PG FMG both. One radiology which is asked, very popular question in both segment, is the radiology of the nose and sinuses. So okay, now the which X-ray is water view and which X-ray is the, you can say, the cardwell view. Now please understand that water view is occipitomental view. Occipitomental view. And if any X-ray is showing maxillary sinus very clearly, if any X-ray is showing maxillary sinus very clearly, it will be water view. Let me tell you a very, very simple answer. If any X-ray is showing maxillary sinus very clearly, it is water view. Now, water view is technically occipitomental view. Now, you can ask me, Dr. Dhawan, what about open mouth, closed mouth? What is Peire view and all that? Okay. Now, water view can be done with open mouth to see the sphenoid sinus, this 𝗔 sphenoid sinus. Okay. Now, water view when done with open mouth is called Peire view. Peire view. So scan the choices first. If Peire view is in the answer, then Peire view is a better answer if water view is with open mouth. If Peire view is not in the answer, then either the answer is water view or cardwell view. Now look at the screen here. If the X-ray does not show maxillary sinus very clearly, this is cardwell's view. There are two views for sinuses, water view and cardwell view. How to differentiate the water view from cardwell view? If the maxillary is clearly visible, it's water view. If maxillary is not clearly visible, then it's cardwell view. And please understand, water view can be done with open mouth. If water view is done with open mouth, is preferably called Peire view. But by chance, Peire view is not in the choice, then it is water view only. So water view with open mouth is Peire view, or not in the choice, then you mark water view. Now, technically speaking, water view is occipitomental view. What is mentum? Chin. Chin. And the cardwell view is occipitofrontal view. What is frontal? Okay. What is frontal? Frontal is the forehead. Now, frontal is forehead. Now, this is again a very popular question, beta. This, X-ray, last time question, beta. Now, please see. Which one is, last time they did not give the X-ray. They gave you the image of the X-ray being done. Very simple question, very simple answer. Look at me. If chin is touching, please see, if chin is touching the X-ray plate, it is water view. And if forehead is touching the X-ray plate, it is what is 𝗘𝗏𝗏 view. If chin is touching the X-ray plate, it is water view. If forehead is touching X-ray plate, it is 𝗘𝗏𝗏 view. बेटा कैसे समझेंगे बेटा? How we drink water? हम पानी कैसे पीते हैं? ऐसे करके, ऐसे चिन ऊपर करके पानी पीते हैं. Chin will touch it. Called well. What is well? कुआं. Well, in the well. How do we look in the well? Well में कैसे देखते हैं? कुएं में कैसे देखते हैं? ऐसे करके, माथा ऊपर करके, माथा ऐसे करके. Now please see how we look in the well, like this. So forehead will touch the X-ray plate. So when पानी कैसे पीते? ऐसे. How we drink water? ऐसे. If chin touches X-ray plate, it is the water view. If forehead touches X-ray plate, it is the 𝗘𝗏𝗏 view. Am I clear? Beta? Fine. Are you able to answer this question? Beta? Fine. 𝗘𝗏𝗏 view, if in the choice, then only to be considered. Otherwise, it's water view or 𝗘𝗏𝗏 view for sinuses. Beta. My dear friend, 𝗬𝗏's view is for the ear. 𝗬𝗏's view and Schuler view is for the ear. Beta. Guys, is this making sense to you? Tell me in the chat box. Yes, ऐसे याद हो जाएगा बेटा. पानी के how drink we water? How we drink water? Like this, okay? Like this. Chin touching the X-ray plate. How we look in the well is like this, beta. Forehead touching the X-ray plate, beta. Okay, fine. Now, everybody, fine. Now, the Schuler view and 𝗬𝗏's view, bachche. Schuler and 𝗬𝗏's view are for the mastoid, ear. They are X-ray for the mastoid. They are used for ear, evaluation. Okay. Schuler view and 𝗬𝗏's view are not for the, are not for the, you can say the sinuses. Sinus के दो ही view है बेटा, water view और 𝗘𝗏𝗏 view. Schuler view, 𝗬𝗏's view belong to ear and it's a mastoid बेटा, mastoids. Okay, chalo. Now, next one बेटा, next one. The tuning fork test बेटा. Now just tuning fork test. Tuning fork test. Most common tuning fork is 512 hertz. Okay, 512 hertz बेटा. Now, Rinne test is comparison of air conduction and bone conduction. If Rinne is given negative, and Weber is heard in the poor ear, beta, it is conductive hearing loss. If Rinne is given negative, beta, what is negative Rinne? Bone conduction better than air conduction. Rinne given negative, bone conduction is better than air conduction, and Weber is heard in the poor ear, then the answer is conductive hearing loss. Beta. What is Weber test? Beta? Weber is you put in the center of the forehead, tuning fork, which side you are hearing it. Okay. So if you are hearing the Weber on the disease side, मतलब poor side, then it is conductive hearing loss. मैं बताता हूँ एक simple तरीका याद रखने का. All of you look at me. All of you press your tragus. बेटा अपना कान बंद करो. Tragus दबाओ. अपना ट्रेगस कान का पिन्ना का ट्रेगस दबा के कान बंद कर लो. Close your tragus. Right now, this is poor ear. This is conductive hearing loss. Sound is not conducting from outside. It's conductive hearing loss. Poor ear. Everybody tight दबा के tragus बोलो. 1, 2, 3 बोलो. 1, 2, 3. Say 1, 2, 3. एक बोलो बेटा बोलो. One say 1, 2, 3. 1, 2, 3. Did you appreciate one thing? You are hearing your own sound on this side. You are hearing your own sound on this side. So exam में क्या याद आएगा? If Weber is heard in the poor ear, it's conductive hearing loss. अगर Weber poor ear में सुनेगा तो conductive hearing loss. Are you able to understand? Okay, fine. Okay, so Rinne given negative, Weber in the poor ear, it's conductive hearing loss. Beta. Now, please see. Let's make it reverse. Beta. If Rinne is positive, ear conduction more than bone conduction, and Weber is heard in the better ear, it is sensory neural hearing loss. अगर Rinne positive दिया हो, air conduction better than bone conduction, and Weber is heard in the better ear, it's sensory neural hearing loss. And the third question is, if Rinne is given negative, मतलब conductive hearing loss. Okay, but Weber is heard in the better ear. If the MCQ says Rinne is given negative, but Weber is heard in the better ear, please see, Rinne negative is conductive hearing loss. Weber better ear is SNHL. Beta. Please see, Weber better ear is what? SNHL. Now, can you make any sense out of this, beta? No, na? Can you make any sense out of this? No. Okay. Now, one second. Can you make any sense out of this? No, na? So, in this case, what you do is, Write down, it's nonsense situation. Write down, it's nonsense situation. It's nonsense situation. Write down. This is actually nonsense because Rene negative किसकी निशानी? Conductive की. Rene negative is the feature of conductive bearing loss. Weber had in the better years SNHL. Then what is the answer, beta? Then the answer is unilateral severe SNHL. Unilateral severe SNHL. Why? This is a case of false negative Rene. It's a case of false negative Rene, beta. It's a case of false negative Rene. False negative Rene, beta. Once again, beta, once again, Rene negative, Weber poor year conductive. Rene positive, Weber better year SNHL. Rene negative और Weber better year. Nonsense beta. Rene negative मतलब conductive, Weber better year मतलब SNHL. It's a case of false negative Rene, and I will mark the answer unilateral severe SNHL beta. Unilateral severe SNHL. Okay, to fine. Now this was about a tuning fork. Okay, to fine. Gaurav, can you please tell me which triangle in the ear, beta? Gaurav, can you tell me which triangle you want? Audiogram, beta, we have got complete video on our channel, DocTutorial channel, audiogram aid easy. Anybody has got any doubt about any audiogram principle or how to solve within 30-40 minutes, you learn everything about audiogram. This audiogram is on the YouTube channel of the same channel as you are right now, beta. Just search that. Okay. Now everybody, now Gaurav, I didn't get you. Which triangle you want, beta? Hearing aid is not asked the paper. Hearing aid is a sound amplifier, beta. Let me tell you what question can be asked. Okay, please see. What is the best ear device or ear implant to be used for bilateral profound SNHL? Bilateral profound SNHL, the best is cochlear implant. But eighth nerve should be normal. Eighth nerve should be normal. What is the best device for bilateral profound SNHL? Cochlear implant, but eighth nerve has to be normal, beta. Okay, now, next one, beta, fine. Next one, the number 2, beta. Now, but in a case of neurofibroma type 2, we have got eighth nerve tumor on both sides. It's a bilateral vestibular schwannoma. Then we put the auditory brainstem implant. Auditory brainstem implant, beta. Auditory brainstem implant, beta. Divya Rajkumar, we have got the complete, audiogram over here. Audiogram made easy on the same channel. Just see that the video, beta. Okay, fine. Okay, to auditory brainstem implant. ABI is placed in NEET PG question, beta. Lateral recess of fourth ventricle. Auditory brainstem implant, 2 question, beta. 2 question. Auditory brainstem implant, 2 question to remember. Indication is neurofibroma type 2. What is the location of the device, beta? 2 × 2, 4, fourth ventricle, beta. 2 MCQ done and dusted. 2 MCQ done and dusted, beta. A auditory brainstem implant, 2 question. Indication is neurofibroma type 2. 2 × 2, 4. 2 × 2, 4, fourth ventricle, beta. Fourth ventricle, beta. Fourth ventricle. Okay. Now, let me take you, beta. Let me take you, everyone. Tubercular otitis media. Very, very, thank you for reminding, beta. Keep putting tricky topics for you, beta. Tubercular otitis media. The tubercular otitis media. The number 1 finding, how to identify this case is multiple perforation of tympanic membrane. Multiple perforation of tympanic membrane. The moment you see multiple perforation of tympanic membrane, okay, we'll find multiple perforation of tympanic membrane. Number 2, pale granulations. Granulation are red in color. But if granulation are pale color, pale, yellow color, it is, think of tubercular otitis media. Multiple perforation, pale granulation. Number 3, plus minus facial palsy. Facial palsy, beta. Facial palsy. Okay, now. Okay. Yes, beta. Let us talk about the thyroid gland question, beta. Very good question. Now, please see, very, very important question, beta. Write down, draw the thyroid gland. At the lower pole, we have got RLN nerve, beta. The recurrent laryngeal nerve, recurrent nerve. And at the upper pole, superior laryngeal nerve, superior laryngeal nerve, beta. Okay. That's the thyroid gland relation. Now, two questions let's discuss, beta. If surgeon damages both RLN, beta. If surgeon damages both RLN during thyroid surgery, only one muscle left is cricothyroid. Only cricothyroid is left. Okay, to find only cricothyroid is left because all muscle are supplied by rectolaryngeal nerve except cricothyroid, which is supplied by external branch of supralaryngeal nerve. Okay, only one muscle left, beta. Okay, find cricothyroid. Put an arrow, beta. And this is adductor muscle, beta. This is adductor muscle. So both vocal cord come in the close position. एक ही मसल बची बेटा क्रिकोथायराइड और वो क्या है adductor. Adductor मतलब close the vocal cord. So it will lead to bilateral abductor palsy of vocal cord. मतलब both vocal cord in midline. Both vocal in midline beta. So patient will have post-operative airway emergency. Let me tell you one beautiful NEET PG question, beta. Can be asked in FMG also. After thyroid surgery, if breathing is a problem, it's a case of bilateral recurrent laryngeal nerve injury. Very, very possible question, NEET PG and FMG also possible. If after thyroid surgery, there is airway emergency immediately after surgery, it is bilateral RLN injury is the answer, beta. So how to solve this? Immediate life-saving treatment will be tracheostomy. Tracheostomy. And then after 6 months wait, we do definitive treatment is type 2 thyroplasty. What is type 2 thyroplasty? Lateralization of vocal cord. Type 2 is lab. Go to lab. What is type 2? Beta? Go to type 2. What is L? Lateralization. What is AB? Abductor palsy. Go to lab. Beta. Go to lab. Go to lab. What is 2? Go to type 2 thyroplasty. Lab. L for lateralization. AB for abductor palsy. So let me tell you one golden question, beta. With golden question is, if after thyroid surgery, if breathing becomes difficulty right after surgery, it's a case of bilateral RLN injury, beta. Okay. Now, let's go to the patient again, bache. If by chance SLN is cut by the surgeon, beta. Okay. Now, please write down. If SLN is damaged after thyroid surgery, if SLN is cut, two branches, beta, ELN, ILN. ELN supplies what, bache? Cricothyroid. Cricothyroid is adductor, but it is main tensor also. And internal laryngeal nerve is the main nerve to prevent aspiration. NEET PG question. Which nerve prevents aspiration, beta? Internal laryngeal nerve. Cricothyroid is main tensor. So chief complaint number 1 will be poor quality of voice. Because cricothyroid is the main tensor of vocal cord. Tensor gives us quality of voice. So chief complaint number 1 and number 2, beta, aspiration, beta. Poor quality of voice, and you examine the patient, you see what? Bowed down vocal cord. If they tell you after thyroid surgery, patient cannot sing properly. Patient cannot sing properly, which nerve got damaged? Supralaryngeal nerve, beta. And what is the appearance? If tensor are gone, vocal cord will be bowed down vocal cord. Now let us do the controversial question, beta. Thyroid, most commonly injured nerve in thyroid surgery is external laryngeal nerve. Most commonly injured nerve in thyroid surgery is external laryngeal nerve. Not right RLN, not left RLN, not SLN, beta. External laryngeal nerve, that is the nerve supply of cricothyroid, beta. Now, second controversial question is, what is the causative organism of acute epiglottitis? Now, that is the answer is Streptococcus pneumoniae is the commonest. Number 2 is Haemophilus influenza B. Guys, do you know this is the controversy? Let us end the controversy, beta. Let's end the controversy, beta. Okay, fine. Now, everybody look at screen, beta. Please see the most commonly injured nerve in thyroid surgery is external laryngeal nerve. Most common causative organism of acute epiglottitis is Streptococcus pneumoniae. Second is Haemophilus influenza B. The third controversial question is ringcase edema. What is the symptom of this patient? It is not diplophonia, it is dysphonia, beta. Why what is ringcase edema? Ringcase edema is seen in smokers, beta, smoker's polyp. It is bilateral diffuse swelling of vocal cord. Bilateral diffuse swelling of vocal cord. So there will be hoarse voice, beta. Please don't mark diplophonia. Dysphonia, beta, I know. One of the controversial question is What is surgical emphysema after tracheostomy? Surgical emphysema matlab air in the subcutaneous plane. Air in the subcutaneous plane after tracheostomy, it can happen. And the cause of surgical emphysema is tight skin sutures, my dear friend. Tight skin suture. It is not posterior tracheal wall tear. Okay, surgical emphysema, the most, what is the meaning of this? It's collection of air below the skin. It can happen in tracheostomy. The cause of this is tight skin sutures. It is not something like posterior tracheal wall tear, etc., etc., etc. Beta. Surgical emphysema. Okay. Now, everybody. Now, any other question, beta? Any other question, everyone? Just leave it up. One more question, which is one more question. What is T1A glottic cancer? T1A glottic cancer is one vocal cord involved. What is T1B glottic cancer? Both vocal cord involved. So glottic cancer T1 has got two types, T1A and T1B. T1A with the one cord involved, T1B with both cord involved, and vocal cord should be mobile. Vocal cord should be mobile. My dear friend, last part of the preparation is the most important part of preparation, beta. In this time, let us end the controversy. Let us reach at one final answer. But the final answer we have to mark, beta. It's a time to consolidate the game, beta. नई नई चीजें नहीं पढ़नी है. डोंट सफर फ्रॉम फोमो. ये वाला नोट पढ़ लेता हूँ, ये क्यूआरपी पढ़ लेता हूँ, ये आरआर, ये पीआर, ये सीआर, ये टीआर, ये एचआर, कुछ ना कुछ चलता रहेगा भाई. Please understand that. We have to put an end spot. Don't suffer from FOMO. Please do not suffer FOMO because there's no end to knowing the medical science. Medical science महामाया है. इसको कोई पूरा ना जान पाया है. मेडिकल साइंस महामाया है बेटा. इसको कोई पूरा ना जान पाया है. तो फिर पूरा जानने के चक्कर में पिछला भी रिवाइज होना रह जाता है. In English बेटा, medical science is a vast ocean बेटा. You cannot know each and every depth of the ocean. Whatever you have gathered till now, revise that, consolidate that, and cache that. Don't suffer from FOMO. Okay, fine. Now, everybody, ring care edema is most commonly seen in smokers, but can be seen in vocal abuse patients also. Better. Now, everybody, now you see. Next one, bache. Next one. Anyone, any controversial question, beta? Now let me take you to cochlea, beta. You know, cochlea. The basal turn of the cochlea senses a high frequency sound, 8,000 hertz. Okay, fine, 8,000 hertz. And the apex of cochlea senses a low 250 hertz, beta, 8,000 hertz. 8,000 hertz and the 250 hertz, beta. Okay, fine. So every part of cochlea is uniquely designed, beta. Which disease damage the apex of cochlea first, beta? Meniere's disease, beta. Meniere's disease damages one cochlea. Meniere's disease damages one cochlea, apex first, beta. Meniere's disease damages one cochlea, apex first, beta. Apex first. Okay. So Meniere disease damage the apex of the cochlea first, this part. So Meniere will cause a low frequency SNHL in early stages, beta. Low frequency SNHL in early stages. Low frequency SNHL in early stages, beta. Low frequency SNHL in early stages, beta. Low frequency SNHL in early stages, beta. Okay. Now, low frequency SNHL in early stages, beta. Now, everybody, now please see. Therefore, we see which audiogram, beta. One second. One second. Therefore, we see which audiogram is the Meniere rising audiogram, beta. Meniere rising audiogram. Meniere rising audiogram, beta. Meniere rising audiogram. Okay. Meniere is rising audiogram. Beta. Rising audiogram. Beta. Now, rising. Meniere is rising, beta. Rising audiogram, but it's only on the one side. Guys, write down. Dip at 4,000 hertz. Everybody know, beta? This will be seen in the noise-induced hearing loss. One second. Everybody, are you there with me? Everyone, please comment one more time. Sorry for the technical glitch. I think we are good now to go. Let us start we were talking about the dip at 4000 hertz is noise-induced hearing loss. It's called acoustic dip or boiler's notch. The person must be working in the high volume noise environment like steel industry, metallurgical industry, or any industry where the lot of noise is there. Dip at 2400 ACBC. Dip at 2000 hertz in bone conduction, Carhart's notch, is a feature of otosclerosis. So otosclerosis will be typically a case of young lady with bilateral hearing loss. Young lady with bilateral hearing loss is the otosclerosis situation. Sloping audiogram is pressed by 𝗂𝗓𝑖𝑠. Pressed by 𝗂𝗓𝑖𝑠, sloping audiogram. How to remember what is pressed by 𝗂𝗓𝑖𝑠? Age-related hearing loss. Age is sloping you down. And rising audiogram. Rising audiogram is Meniere's disease. Meniere's disease. Rising audiogram. How to remember rising? Because age causes high frequency hearing loss. More hearing loss this side. And the Meniere's causes low frequency hearing loss, more loss on this side. So Meniere is rising audiogram and age is sloping audiogram. Okay. Now please tell me, radical neck dissection is important. Radical neck dissection matlab, let us clear the cancer neck nodes from the neck. Along with the cancer neck nodes, we remove all the structures coming in contact with these neck nodes. So what are the structure removed in R&D? Level 1 to level 5 neck nodes. Number 2, 𝗙𝗏-𝗪𝗏 muscle. Number 3, internal jugular vein. Number 4, excessive spinal nerve. Number 5, omohyoid muscle. Then tail of parotid gland and submandibular gland. Level 1 to level 5 neck nodes. The 𝗙𝗏-𝗪𝗏 muscle, internal jugular vein, the 11th nerve, and omohyoid muscle, tail of parotid gland, and submandibular gland. Now, very famous question is modified R&D. Modified R&D, MR&D. MR&D means little less radical. It is R&D only, but few structures are saved. It is R&D only, but few structures are saved. Please comment in the chat box. Are you with me, beta? Okay. Now everyone all okay now? Now this is of three type, beta. Three type. We do R&D only, but we save few structure. If you save 11th nerve, it's type 1 R&D, beta. If you say 11th nerve plus internal jugular vein also, it is type 2 modified R&D, beta. And in type 3, you save 11th nerve, internal jugular vein, and 𝗙𝗏-𝗪𝗏 muscle, beta. This is very, very important question for the upcoming examination. Okay, fine. So type 1 is when you do R&D, but you save the 11th nerve. Type 2 is when you do the R&D, but you save the 11th nerve plus internal jugular vein. Type 3 is when you do the R&D, but you save the 11th nerve, internal jugular vein, and 𝗙𝗏-𝗪𝗏 muscle, beta. 𝗙𝗏-𝗪𝗏 muscle. My dear friend, I really, really want to tell you one picture which is highly likely in the paper, NEET PG FMG both paper. The one question which is being commonly asked is about the post-laryngectomy patient, beta. Post-laryngectomy patient, how they produce the voice. Now, post-laryngectomy patient, please see, after total laryngectomy, we have a permanent tracheostomy, beta. After total laryngectomy, we have permanent tracheostomy. This picture is very, very important. This picture has got 3 MCQs of NEET PG also, beta. Number 1, what surgery has been done on this patient? The answer is total laryngectomy. What is the name of this hole? Permanent tracheostomy. What is the name of this device? Tracheoesophageal puncture device. Tracheoesophageal puncture device. Okay, fine. Guys, Tawfiq Ahmed or everyone who are doing the old notes, I always tell them, see the latest notes of this time, because every time the trend has to be followed actually. Okay, fine. Okay, fine. Now TP device, this is a visual question. Anything like this in larynx is tracheoesophageal puncture device, and the example is Blom, Singer prosthesis, and Provokes device. Provokes device. Okay, tracheo-esophageal puncture device are of different types, beta. The common one are Blom-Singer prosthesis and Provokes device. Don't forget this picture, beta. So this is what the very likely question again, beta. Now everyone, Rachila Srinidhi, modified R&D type 3 means you do R&D, but you save three structure. You preserve three structure: the excessive spinal nerve, internal jugular vein, and sternocleidomastoid muscle, beta. Okay, fine. Now everyone, okay. Now we already done the Rene test, Weber test, beta. We've done the Rene and Weber test. Now everybody, Rene is comparison of air conduction and bone conduction, and Weber is when you keep the tuning in the center of the forehead and ask the patient which side you are hearing it. Now, let me take you to the clinical scenario-based question, which are confused by the students better. Number one is laryngeal foreign body. Now, please see, how will you diagnose laryngeal foreign body? Now, laryngeal foreign body, while eating, there is choking and aphonia. Whenever you see the word choking and aphonia while eating something, it's a question of laryngeal foreign body. And everybody comment in the chat box, what is the best first treatment for laryngeal foreign body? Okay, fine. Okay, fine. What is the best treatment for laryngeal foreign body? Everybody comment in the chat box, beta. Everybody, please inform your friend it has started again. Inform your friend we have started again, beta. Heimlich maneuver. Please don't write Heimlich maneuver in any other foreign body. Heimlich maneuver, beta. Heimlich maneuver. Okay, fine. Number two, beta. Number two, beta. Number two, a child while playing develop cough and breathlessness. Sudden cough and breathlessness in a child who is playing. Cough will be foreign body bronchus. Foreign body bronch. Very famous question for NEET PG FMG both, beta. Okay, foreign body bronchus, beta. Right more than left. Whenever बच्चा खेल रहा था, खेलते playing child, beta. Playing मतलब normal child. Playing child. He was playing with his toys or something. And there's a foreign body bronchus, beta. Foreign body bronchus, right more than left. In this case, we do the X-ray chest, beta. X-ray chest. Now, question for radiology. What are three findings possible on X-ray chest? Number one, it can be collapse. Most commonly, collapse, beta. Number two, it can be hyperinflation. Sometimes foreign body allow the entry of air, but they don't allow the exit of the air, beta. And number three, it can be normal X-ray, beta. Normal X-ray. Now the NEET PG question, treatment is urgent rigid bronchoscopy. Urgent rigid bronchoscopy and removal, beta. Urgent rigid bronchoscopy, beta. Okay, to find urgent rigid bronchoscopy. Okay, to find. Now, most commonly finding is collapse. Second is hyperinflation. Third is normal X-ray also possible, beta. Now the third foreign body, beta. A child was playing and he developed throat pain and dysphagia, not dyspnea, beta. Throat pain, dysphagia means it's a foreign body esophagus. Foreign body esophagus, beta. Foreign body esophagus. Yeah, na? Okay, foreign body esophagus. So again, we get the X-ray done. Okay, X-ray done. And when you do the X-ray of a coin, when coin is in the esophagus, beta. When coin is in the esophagus, you will see the full coin on the X-ray, beta. You will see the full coin X-ray in the anterior-posterior view, beta. You see the full coin X-ray, beta. Look at me, please see. Whenever you see the full coin on the X-ray like this, it is on the AP view. It is the esophagus, beta. And lateral view will be the edge of the coin, beta. Very easy, beta. Very easy. Can you see the front, beta? Front. What is O? O for esophagus. O for esophagus, beta. O for esophagus, beta. Esophagus. Okay. If you see O in the front, O for esophagus. And in trachea, it will be reversed, beta. In trachea, look at trachea. In trachea, AP view, you see the edge of the coin. And the lateral view, you see the edge of the coin, the full coin, beta. So if you see full coin in the X-ray, in the front AP view, it's coin actually in the esophagus. If you see the edge of the coin on the AP view, it's in the trachea, beta. For just remember one thing, beta. Battery will be different from the coin because battery will be having double ring, beta. Anytime you get X-ray, please see very clearly, coin will have single ring. this will have double ring, beta, double ring. Okay, double ring. So coin would not be a major problem. So treatment, if it is a coin in esophagus, will be rigid esophagoscopy. Please don't write flexible, beta. Rigid esophagoscopy. But if it is a battery, beta, it's a bad disc battery, then it will be urgent rigid bronchoscopy, because urgent rigid bronchoscopy, urgent rigid bronchoscopy ऐसा इसलिए नहीं है कि बैटरी से बच्चा स्टार्ट हो जाएगा बेटा, ऐसा नहीं अर्जेंट इसलिए कर रहे हैं कि बैटरी से बच्चा स्टार्ट हो जाएगा. वी आर नॉट डूइंग अर्जेंट बिकॉज वी आर डूइंग अर्जेंट बिकॉज द बैटरी रिलीज alkali and the alkali can cause esophageal perforation beta. That will lead to esophageal perforation beta. Okay, so they can make advanced question beta. Urgent rigid bronchoscopy and removal, and keep the patient nil per orally for few days beta. You know, there may be already perforation beta. So keep the patient nil per orally, give the only sterile saline for few days, and put, you know, wait and watch beta. Okay, fine. Okay, very good beta. Very good. Now, any other doubtful topic in your mind? Any controversial question? Because the name of the series was Ask Me Any Doubt beta. Doubt solving session. Okay, autophony, very good, beta. Keep reminding me, these are the fantastic new topics, beta. Autophony, this is a feature of patulous eustachian tube. Patulous eustachian tube, beta. Autophony, patulous eustachian, patulous matlab weak. Weak matlab always open. Always open, beta. You know, eustachian tube is always closed. It only opens during swallowing with the help of tensor villi palatini muscle. MCQ beta, anatomy question. Eustachian tube. Eustachian tube is normally a closed tube. It only opens during swallowing in you and me with the help of tensor villi palatini muscle. If this tube is always open, it is called patulous eustachian tube beta. Patulous eustachian tube, it's a weak tube beta. It's always open. It's always open. So autophony, अपनी आवाज सुनते रहना beta. Autophony plus feeling of movement of tympanic membrane with breathing beta. Feeling of movement of tympanic membrane with breathing is a feature of patulous eustachian tube beta. Patulous eustachian tube is seen in pregnancy and rapid weight loss. Either rapid weight gain or rapid weight loss beta. Pregnancy or rapid weight gain. Okay, fine. Okay, fine. Now, rapid weight gain and the rapid weight loss beta. Okay. Now, okay, next one, next one. Anybody who can tell any doubtful question beta? Difference between 𝗁𝐶 and 𝗁𝗂 beta. Please see, a very beautiful question. If uvula is angulated beta and tonsil is pushed medially, it is 𝗁𝐶. अगर uvula टेढ़ा है तो पहला आंसर 𝗁𝐶 है. Okay, fine. Angulated uvula, 𝗁𝐶, and patient will be having two definite feature beta: trismus and hot potato voice beta. Difficulty in opening mouth, hot potato voice, plus angulated uvula, everything pushed on the other side because there's a pus collection here beta. 𝗁𝐶, the other name is peritonsillar abscess. Peritonsillar abscess beta. Peritonsillar abscess beta. Peritonsillar abscess. Okay, fine. Yeah. Now, next one beta. 𝗁𝗂 is only edematous uvula. Uvula is having edema. No angulation beta. 𝗁𝗂 is edema of the uvula beta. 𝗁𝗂 is the edema of uvula. 𝗁𝗂's disease beta. Edema of the uvula beta. Okay. Now, somebody asking nasal bone fracture. Yes, controversy beta. Everybody, nasal bone fracture. Let's please see, there are two questions about nasal trauma. If after trauma to nose, there is nasal deformity, then we have to think about nasal bone fracture. Now, nasal bone fracture can be having two questions beta. No swelling, then immediate fracture reduction with the Walsham forceps. And if swelling is mentioned, then wait for 7 days to let the swelling subside, then do the fracture reduction. So if it is no swelling, then immediate. If swelling there, then after 7 days. The procedure is same beta. Close reduction using which forceps? Walsham force है बेटा. Which force है? Walsham. WALSHAM. Walsham force है. Now, if after nasal trauma, the MCQ says bilateral nasal blockage. Bilateral nasal blockage, beta. Then the answer will be septal hematoma. So nasal trauma can give you 2 MCQ, beta. If it says that there is nasal deformity, beta, nasal deformity, then you have to think about nasal bone fracture. If it says bilateral nasal blockage, think of septal hematoma, beta. Septal hematoma. You have to find septal hematoma. Okay, to find now. Okay. Septal hematoma, what is the treatment? IND, what is incision and drainage, or aspiration. Aspiration. Now, next one, beta. Rhinolalia. Somebody asked me, Rhinolalia 𝗁𝗂𝗧. Rhinolalia. This word is important, beta. Rhinolalia 𝗁𝗂𝗧. What is rhino? Nose. 𝗁𝗂𝗧 means closed. Nose is closed, beta. Hyponasality of voice. आवाज dull है. Hyponasality or dull voice, beta. Nose closed, beta. The classical cause of this is adenoid hypertrophy, beta. Rhinolalia 𝗁𝗂𝗧. Rhino means nose, 𝗁𝗂𝗧 means close. The adenoid closes the nose from backside. Number 2, nasal polyp. In these two situations, don't forget that the voice is dull and that voice is called rhinolalia 𝗁𝗂𝗧. Okay, to find rhinolalia 𝗁𝗂𝗧. Next one. In which 5 MCQs we have to write the conservative treatment, मतलब non-surgical treatment, beta. Okay. Number 1 is laryngomalacia. 5 MCQ of NEET PG FMGE exam, in which we have to write the non-surgical treatment or conservative treatment or wait and watch. Laryngomalacia, you know, supraglottic weakness. No, nothing. Don't worry. Patient will be having no, you know, like cyanosis, no hypoxia. Baby is fine. So treatment is conservative, beta. Number 1. Number 2, unilateral vocal cord palsy. Unilateral vocal cord paralysis, beta. Number 3, everybody, CSF rhinorrhea. Don't go for urgent surgery. Remember in the video we discussed that CSF rhinorrhea, beta. Treatment is conservative treatment for bed rest with bed rest and antibiotics, beta. Okay. Wait for 7 to 10 days. If the fracture does not heal, then you can go for surgery. But the treatment are no urgent surgery, beta. Conservative. And number 4 is the traumatic perforation of tympanic membrane. Traumatic perforation of tympanic membrane. Trauma में no ear drop, no surgery, only analgesics plus keep the ear dry. Don't put the ear drop, beta. Don't put the ear drop. Number 5, bache. Number 5. Number 5 is vocal nodule, beta. Don't operate vocal nodule as the primary treatment. The best treatment of vocal nodule is speech therapy or voice rest plus proton pump inhibitor, because acidity also contributes with reflux, beta. We're going to find. So in 5 MCQs, beta, you have to write conservative or non-surgical or wait and watch approach, laryngomalacia, single-sided cord palsy, CSF leaks, traumatic perforation of tympanic membrane, and vocal nodules, beta. Everybody? What is the next question? Rhinolalia aperta. Okay. Rhinolalia aperta is the reverse of rhinolalia 𝗁𝗂𝗧. Rhinolalia aperta is the reverse of rhinolalia 𝗁𝗂𝗧. Aperta मतलब aperture, मतलब hypernasality of voice. Hypernasality of voice. 𝗁𝗂𝗧 was hyponasality. This is hypernasality. This is typically seen in cleft palate. Please see, if palate has a cleft, then the nose air is coming to the mouth continuously. So your voice has got more dominance of the nasal element in the voice. जब आप बोलते बाबा, then आवाज आती मामा, like that. बच्चे ने बोला बाबा, आवाज आई मामा, like that. Why? Nasal element is dominating. Hypernasality of the voice. Rhinolalia aperta. Rhinolalia aperta, beta. Please, beta, please, everybody. Everyone, any other doubt anyone has, beta? Anyone, any doubt, beta? Let us revise in the meantime 3 triad, beta. First is Trotter's triad. Trotter's triad is a feature of nasopharyngeal carcinoma. Its mnemonic is also NPC. What is NPC, beta? N for neuralgia in temporoparietal area due to 5th nerve involvement. P for palatal paralysis due to 10th nerve involvement, and C for conductive hearing loss due to glue ear. So the Trotter's triad is seen in nasopharyngeal carcinoma. Its mnemonic is also NPC, N for neuralgia in temporoparietal area due to 5th nerve involvement, P for palatal paralysis due to 10th nerve involvement, and C for conductive hearing loss due to glue ear. Number 2, Samter's triad. Now, Samter's triad is seen in allergic diathesis. Samter's triad is number 1 is the nasal polyp, which is the ethmoidal polyp, which is the allergic polyp, and this is bilateral polyp. Number 2, asthma. Asthma is intrinsic asthma. And number 3 is the allergy to NSAID, particularly aspirin. Allergy to NSAID, particularly aspirin. The third triad of your exam is Grady-Negro syndrome. Grady-Negro syndrome is the other name of Petrositis, because at the petrous area we have got 2 nerve, 5th and 6th nerve. The mnemonic is very interesting, beta. G-E-R-D. E for ear discharge. The R for retroorbital pain due to 5th nerve involvement, and D for diplopia due to 6th nerve involvement. Why? Because at the petrous apex, 5th and 6th nerve are there. They are damaged by the infection from the ear. So GERD, Grady-Negro syndrome. G for Grady-Negro, E for ear discharge, R for retroorbital pain, D for diplopia due to 6th nerve involvement. Now everyone, nasal mask is very popular in NEET PG FMG both, beta. Nasal mask, 3 question, 3 diagnosis possible, beta. How to diagnose? Nasal mask, beta. First of all, let me tell you 3 masks, beta. Number 1, if a mask is growing backward towards quena, better seen on posterior rhinoscopy, and no bleeding, no epistaxis, it is a enteroconal polyp. Polyps never bleed, beta. Enteroconal polyp. Number 2, beta. Number 2, if the mass is a reddish, smooth, firm, okay, with epistaxis positive, beta. Bleeding is there, beta. Then think about the inverted papilloma, also called as Ringett's tumor, papilloma or Ringett's tumor. Tumor always bleed, na? Ringett's tumor. This is a very common doubt people have. What to mark where, beta? It's not that difficult. If you know the logic, you know the logic. And if it is a irregular studded surface mass, beta, the mass with irregular surface, and there is epistaxis, and patient come from South India, coastal areas of Tamil Nadu, and there is history of pond water contact, beta. Pond water, some water contact will be there. Then the answer will be rhinosporidiosis, beta. Short question, beta. Short question, beta. 1 is enteroconal polyp. 3rd is inverted papillary ringlet tumor. 3rd is rhinosporidiosis, beta. Does it make sense to you, Biche? Is this session helping you to clarify which answer to tell confidently? A mass growing backward, better visible on posterior rhinoscopy, is enteroconal polyp. And the most important thing is polyps never bleed, beta. No bleeding, beta. Everybody, now if the mass is reddish, smooth, firm, with epistaxis, okay, inverted papilloma tumor or Ringett's tumor, and this tumor is benign but locally invasive tumor. And if the mass is irregular surface with epistaxis, patient from South India, coastal area of Tamil Nadu, pond water contact, and then answer is rhinosporidiosis, beta. Rhinosporidiosis, everybody. Rhinosporidiosis. Anyone has any question, beta? Any question, anyone? Any question, beta? Let me make you revise in the meantime. Chronic foul-smelling ear discharge is a diagnosis of unsafe 𝗔𝘂𝗯𝘁, also called the aticoantral 𝗔𝘂𝗯𝘁. Aticoantral matlab the cholestoma, aticoantral 𝗔𝘂𝗯𝘁. Okay, aticoantral 𝗔𝘂𝗯𝘁, which is, cholestoma has got bone eroding property. So chronic foul-smelling ear discharge has got the unsafe 𝗔𝘂𝗯𝘁 or as a diagnosis. So chronic foul-smelling ear discharge with vertigo. If vertigo happens in this patient, beta, then think about labyrinthine fistula of lateral semicircular canal. Okay, vertigo, Think about labyrinthine fistula of lateral semicircular canal beta. Number 2, headache, vomiting, and convulsions. Think about the brain abscess beta. And brain abscess due to ear infection is mostly seen in the temporal lobe. And treatment is neurosurgery beta. Third one beta, if you see mastoid edema written in an ear discharge patient, think about mastoiditis. Mastoiditis beta. Okay, chronic foul-swelling ear discharge with mastoid edema, think of mastoiditis beta. And if you see mastoid edema written, but along with that, there is headache. Headache always point toward brain infection beta. Headache plus spiky fever. Then you write the answer, unsafe CSOM with the sigmoid sinus thrombosis or lateral sinus thrombosis beta. Once again beta, chronic foul smelling ear discharge has got one diagnosis in the mind, unsafe CSM or aticoenteral seizure, means presence of cholestoma. If chronic foul smelling ear discharge with vertigo happens, it's a complication of unsafe CSM, which is called labyrinthine fistula of the lateral semicircular canal. If headache, vomiting, convulsions happen, think of brain abscess, most commonly temporal lobe. Treatment is neurosurgery beta. If chronic foul smelling ear discharge with edema on the mastoid, think of mastoiditis. But if with mastoid edema there is headache and along with that spiky fever written, then sigmoid sinus thrombosis or lateral sinus thrombosis beta. Okay, fine. Any doubt beta anyone has beta? Anyone, any doubt, bache? Any doubt? Anyone has any doubt beta? Any doubt? If all of you, please see there is another video there, you audiogram made easy about the PTA. Everybody has got PTA fear, but don't have any PTA fear, but okay, fine. Now, please write in the chat box any doubtful question in your mind still, better. In the meantime, let me go through, quickly the 10, clinical, vignettes which are actually popularly asked in the paper, better. Okay, everybody. Now, now you have to comment on diagnosis beta. Everyone has to comment. What answer come to my beta? 28-year-old female with bilateral gradually progressive hearing loss beta. I'm waiting for everyone to comment. Which is the first always mark the most probable diagnosis beta. Don't go for rare diagnosis. Everybody, a young female with bilateral gradually progressive conductive hearing loss. What is the diagnosis in your mind beta? May I have your attention, please, beta? Tell me. Yes, it is otosclerosis, beta. Very good, otosclerosis. Let's see, beta. A young female with both side hearing loss is otosclerosis question. And don't forget, there is a 𝗗𝗚𝗏𝗂𝗓𝗃. The patient near better in noisy area. 𝗗𝗚𝗏𝗃. Don't forget Carhart's notch, dip at 4,000 Hz in bone conduction curve. Don't forget the early stage of the disease is pink in color. That gives Schwartz sign. If Schwartz sign is positive, then treatment is sodium fluoride. Otherwise, treatment is surgery. And the best name of surgery is stapedotomy or stapedectomy. Now, second question, beta. 45-year-old female with the pulsatile tinnitus or bleeding ear mass is, of course, the glomus tumor, beta. Glomus. Any lady with something pulsating or bleeding in the ear is glomus question. Any young boy with the nasal mass and epistaxis is the angiofibroma question, beta. So this lady has got the young lady, the lady with the pulsatile tinnitus or bleeding. Any lady with something pulsating or bleeding in the ear is glomus question. And this patient will be having rising sun sign. It's a middle ear tumor, beta. It's a middle ear tumor. So patient will be having conductive hearing loss and RNA will be negative, beta. RNA will be negative, beta. RNA will be negative. Conductive hearing loss, beta. 50-year-old patient with unilateral conductive hearing loss and or cervical lymphadenopathy. Very likely question, beta. Very, very star question possible. NEET PG, particularly nasopharyngeal carcinoma. Guys, glue ear. This is the case of unilateral glue ear. Unilateral glue ear, beta. Unilateral glue ear in an adult of 50 to 70 year is a direct suspicion of nasopharyngeal carcinoma. It's a hidden cancer, occult primary. So the most common presentation is neck, cervical, metastatic lymphadenopathy. Metastatic cervical lymphadenopathy, beta. Metastatic cervical lymphadenopathy. Okay, fine. Now, so in this patient, guys, if a child has a glue ear, I'm not worried. It's It's a case of adenoid hypertrophy with glue ear. Because adenoid disappear by 20 years of age. If 50 to 70-year patient is having unilateral glue ear, I am suspecting nasopharyngeal carcinoma. It's a hidden cancer, and it is most common presentation is metastatic cervical lymphadenopathy, or number two is the conductive hearing loss due to unilateral glue ear. But guys, please understand, glue ear is mostly seen in children. Glue ear is mostly bilateral in children because it is due to adrenal hypertrophy. But in NPC, it's unilateral glue ear, beta. It's a radio-sensitive tumor. So one doubtful question, beta. The best treatment for nasopharyngeal carcinoma is chemoradiation. Matlab, radiotherapy plus chemotherapy. But if you don't see this in choice, then mark radiotherapy. Beta. Mark radiotherapy. Okay. Now, 12-year-old boy with nasal mass and perfuse epistaxis is definitely juvenile nasopharyngeal angiofibroma. It's a highly vascular tumor. Why this tumor bleeds a lot? Very likely question, but again, this tumor is made of blood vessels which do not have what? Muscular layer, beta. Why angiofibroma bleeds so much? Because this tumor is made of blood vessels which do not have muscular layer, beta. Muscular layer. Okay, don't forget the Hallman-Miller sign of CCT in angiofibroma. Now, a long-standing history of foul-smelling ear discharge. Everybody, now you tell me, beta, what is the answer? Foul-smelling ear discharge, long-standing chronic discharge is unsafe CSOM or atico-antral CSOM, beta. Atico-antral CSOM, beta. Any child with single-side foul smell nasal from nose, beta. Let me tell you a secret, beta. A school child with smell from nose is foreign body nose, beta. A school child with smell from the nose, with foreign body nose, beta. Foreign body nose. Now, okay, if you have got a young child with the chronic hoarseness of voice, with mild respiratory difficulty, it is juvenile papilloma of larynx. Juvenile, it is seen in 3 to 6 years of age. Juvenile papilloma, it is caused by human papillomavirus 6 and 11, beta. Okay, child with chronic hoarseness, beta. The answer is juvenile papilloma of larynx, beta. Very likely question. Female patient, 40-year-old with episode of vertigo on changing head position. Vertigo on changing head position is benign paroxysmal positional vertigo, beta. In BPPV, the vertigo is for few seconds only, and it is pure vertigo. There's no hearing loss, no tinnitus, beta. No hearing loss, no tinnitus. Meniere's has got no positional element in vertigo. Meniere is episodic. The episode of 3 feature, beta: vertigo, tinnitus, hearing loss. But BPPV has got no hearing loss, no tinnitus, beta. Okay, now 29-year-old patient with thick nasal mucin and heterogeneous nasal polypi on CT scan. See, very famous question of NEET PG, beta. Heterogeneous nasal polypi on CT scan. Heterogeneous nasal polypi is a allergic fungal sinusitis, beta. Allergic fungal sinusitis, AFRS, beta. The normal polypi are homogeneous, beta. Fungal polypi are heterogeneous, beta. Okay, to find heterogeneous. Okay, that allergic fungal rhinosinusitis, beta. Allergic fungal rhinosinusitis, beta. A young patient with roomy nasal cavity, nasal crusting, and hard external nose, beta. The moment I see roomy cavity, nasal crusting, I think about atrophic rhinitis. But in atrophic rhinitis, there is no hard external nose, beta. Atrophic rhinitis plus hard external nose is equal to rhinostroma. My dear friend, up to this roomy nasal cavity crusting, the diagnosis will be atrophic rhinitis. But if you add into this hard external nose, the answer becomes the rhinostroma, because the first stage of rhinostroma is just like atrophic rhinitis. 2 famous questions of your paper, beta. Quinsy-like MCQ, like trismus, hot kind of voice, uvula pushed to the side, plus outer neck swelling close to angle of mandible is parapharyngeal abscess, beta. And atrophic rhinitis like MCQ, crusting, bad smell from nose, wide cavities. Along with that, if hard external nose is written, it is rhinostroma or woody nose, beta. Rhinostroma, woody nose, beta. Somebody is asking about the Tullio's phenomenon, beta. Tullio's phenomenon is vertigo on hearing loud sound. Vertigo on hearing loud sound. Your famous question, NEET PG FMGE both, beta. It is a feature of Meniere's disease and superior semicircular canal Dyson syndrome, beta. Tullio's phenomenon mean the patient gets vertigo on hearing loud sound. It's a feature of the Meniere's disease and superior semicircular canal dehiscence syndrome beta. Now this patient will also have a conductive hearing loss due to leakage of sound energy from this dehiscence. And nature only gave us two window beta. And the third window is leaking sound energy. This is called third window phenomenon. Very likely question NEET PG beta. Third window phenomenon is a feature of superior semicircular canal dehiscence syndrome. Superior semicircular canal dehiscence syndrome beta. Am I missing any controversial question beta? Am I missing any controversial question in your mind beta? Anyone beta? What is the best treatment for T3 and T4 laryngeal carcinoma? Is of course total laryngectomy plus minus R&D followed by radiotherapy. If not given the choice for NEET PG, then concurrent chemoradiation. I'm touching upon all the controversial question I have been seeing in the Instagram, Telegram, etc. Beta. Okay, beta, fine. So what is the best treatment for T3, T4 cancer? Total laryngectomy plus minus radical neck dissection followed by radiotherapy. If by chance not mention a choice or patient is not willing for surgery of laryngectomy, then concurrent chemoradiation beta. Chemoradiation. Okay. Now, Ghilie's test beta, very good. Ghilie's test is a test for otosclerosis beta. Ghilie's test is a test for otosclerosis. Now, what is otosclerosis? Fixation of stapes foot plate. The ossicle are tight actually. So what happens beta? What happens? If you are doing the bone conduction in a patient beta, bone conduction in a patient like that, and if you do Gschiglization of a normal person of you and me, on Gschiglization, the ossicle become tight. So what will happen? The bone conduction will be now less heard, beta. Less heard. Okay, in you and me, beta. But if you do the same thing, you do the bone conduction, and if you do Gschiglization, matlab you put the air pressure in the ear, the ossicle will become tight in normal people. So bone conduction will be heard less in normal people, beta. But in otosclerosis, the system is already tight. Otosclerosis system is already fixation of stapes foot plate. System is already tight. If while doing bone conduction, if you do simultaneous Gschiglization, there will be no change in the bone conduction. That is a feature of otosclerosis. Otosclerosis beta. Otosclerosis beta. Okay. Bill's bar. Bill's bar is an anatomy question beta. It is a vertical bony septum in the upper part of the internal auditory canal. It's the internal auditory canal or internal auditory meatus is a canal on the posterior surface of the temporal bone. That's the entry point of the seventh and eighth nerve. So Bill's bar is a vertical bony septum in the upper part of the internal auditory canal. Now, let me summarize the Bell's palsy points to remember. Bell's palsy is lower motor neuron facial palsy. It is mostly unilateral. There is edema of the nerve due to HSV1 infection. Okay, but not proven. The forehead muscles are paralyzed. Yes, forehead muscles are also paralyzed. One complete half of face is paralyzed, including the forehead, with angle of mouth deviated to normal side. Normal means opposite side. Opposite means contralateral side. So what is the correct answer of that question, beta? Controversial question. One complete half of your face paralyzed, including the upper part forehead, angle of mouth pulled towards the normal side or opposite side or contralateral side. In the ear, you got which 𝗚𝗂𝑐𝑖S? Hyperacusis. Loss of which fold? Nasolabial fold. Drug of choice, prednisolone steroid for edema. Acyclovir is only given if patient come within 3 days, beta. Good to find. Now, everybody, the audiogram beta Venkateshwaran. Everybody, audiogram, I'm telling you, there is the same channel has got a very crisp video, audiogram made easy beta. See that video. It will cover hopefully the whole audiogram. I would like to know in the comments of that video also, was that video helpful on doctoral channel or not, beta? Now, croup is biphasic stridor. Yes, beta. In which two diseases you have to mark the inspiratory stridor, which is the supraglottic diseases. Number one is laryngomalacia. Number two, acute epiglottitis. In these two conditions, you have to mark inspiratory stridor. Inspiratory stridor. So inspiratory stridor would be marked in two MCQs, laryngomalacia and acute epiglottitis, because that is supraglottic involvement. But croup has got the main involvement of subglottis. The answer is, if they ask you, type of stridor in croup is biphasic, but yes, but mostly inspiratory. One doubtful question about croup is, Can you have treatment of group as conservative treatment? No. Look at that question, beta. Controversial question. Patient came to emergency with difficulty in breathing. Don't do conservative treatment, beta. Best treatment group is number one is the humidified oxygen with helium, beta. With helium, preferably. Number two, bronchodilator. Which one, beta? This one is the racemose epinephrine nebulization. Number three, steroid, beta. Which one, beta? Dexamethasone. Antibiotic are not required, beta. Antibiotic not required. Don't follow old notes. I'm telling you, Nelson has, always the guidelines have to be recent actually. So humidified oxygen, the bronchodilator in the form of epinephrine nebulization, plus the steroid in the form of dexamethasone, beta. Sweetie Goel, what to remember the differentiation of cochlear versus retrocochlear. When I say cochlear, I say Meniere's disease, beta. When I say retrocochlear, I mean acoustic trauma. How to differentiate, beta? For cochlear from retrocochlear, beta. 4 points to remember, everybody. Number one, tone decay is faster in retrocochlear. Recruitment is a feature of cochlear. Number three, SISI score, short increment sensitivity index score of a cochlear disease patient is better than normal. And number four is speech audiometry. The retrocochlear hearing loss shows a very poor speech discrimination score and a rollover phenomenon is positive. Once again, cochlear versus retrocochlear, 4 points to remember, beta. Tone decay faster, retrocochlear. Recruitment positive, cochlear. This SISI score better than normal, cochlear. Very poor speech discrimination score and rollover phenomenon, retrocochlear, beta. Retrocochlear. Now, for electrophysiological testing, beta, if you give sound to ear and you record current from the brain, it's called BERA or ABR, beta. From auditory pathway, you record the current from brain. The most important wave is wave 5, and that is produced by lateral lemniscus, beta. Now, if you give sound to the ear and you record the echoes from the cochlea, it is called otoacoustic emission. And they are produced by outer hair cells of cochlea, beta. Outer hair cells of cochlea. They are the echoes of the cochlea, sound echoes of cochlea. Now, if you give sound to the ear and you record the electrical activity of sternocleidomastoid muscle, it's called VAMP, beta. Vestibular evoked myogenic potential. Vestibular evoked myogenic potential. It is the test of inferior vestibular division of 8th nerve, and it tests the saccule also, beta. But what we do in saccule, what we do in VAMP, what we do, we stimulate the saccule with loud sound and we record the electrical activity in sternocleidomastoid muscle. It's called vestibular evoked myogenic potential. It tests which nerve? The inferior vestibular division of the 8th nerve and saccule, beta. And lastly, if you give sound to the ear and you record the electrical activity from cochlea only, it's called electrocochleography, which is used for Meniere's disease. In that, we record summation potential and action potential. So summation potential, action potential ratio, SP-AP ratio, more than 30% is suggestive of Meniere's disease, beta. Once again, beta, 4, beta. If you give sound to ear and you record current from auditory pathway in the brain, BERA. If you give sound to ear and you record echo from cochlea, otoacoustic emission. If you give sound to ear to stimulate saccule and you record the contraction of this muscle, vestibular evoked myogenic potential. If you give sound to ear and you record current from cochlea, it's called electrocochleography, which is used for Meniere's disease, beta. Meniere's disease. Cottel's test, beta. Cottel's test, all of you please. Cottel's test, look at me. Whenever you keep a finger on the cheek and lift it upward, it's Cottel's test to diagnose the blockage of nasal valve area. Okay, any ulcer on the nose skin or the pinna skin is basal cell carcinoma. Any ulcer on the nose skin or the pinna skin is basal cell carcinoma. Okay, fine. Now let me tell you some key nerves, beta. Patient started coughing during cleaning of the ear is Arnold nerve stimulation, beta. Arnold nerve stimulation. Okay. Patient had syncopal episode during cleaning of the ear, unconscious blackout. Again, Arnold nerve, which is auricular branch of vagus nerve, beta. Tonsillitis or tonsillectomy cause earache due to the Jacobson nerve, which is the tympanic branch of glossopharyngeal nerve. Okay, fine. So tonsillitis, tonsillectomy cause earache due to Jacobson's nerve, beta. And supraglottic cancer, piriform sinus cancer cause earache through, again, Arnold nerve, beta. Arnold nerve, and that is auricular branch of vagus nerve, beta. A patient developing anesthesia of the pinna lobule after parotid gland surgery is due to injury to greater auricular nerve. Greater auricular nerve injury during parotid gland surgery will lead to anesthesia of the lobule of the pinna, beta. And if patient has got the submandibular gland surgery or parotid gland surgery, and this dropping of angle of the mouth, beta. Dropping of angle of the mouth is due to marginal mandibular nerve, beta. Marginal mandibular nerve. Surgery question, beta. After the parotid gland surgery or submandibular gland surgery, if the angle of mouth is dropping down, it's marginal mandibular surgery. Marginal mandibular nerve, beta. Marginal mandibular nerve. I hope that has solved some controversies in your mind, bache. And one more controversy about Frey syndrome. Frey syndrome surgery question. It is a complication of parotid gland surgery, particularly superficial parotidectomy. It is due to injury to which nerve fiber? Auriculotemporal, not facial, beta. Auriculotemporal nerve injury, beta. Frey syndrome, the gustatory sweating in this area after parotid gland surgery. There is sweating in this area during eating. It is not due to facial nerve, etc. injury. It is due to the injury to auriculotemporal nerve, beta. Okay, fine, fine. Mucormycosis, beta. Mucormycosis, please understand, 5 patient, beta. Number 1, HIV positive patient. Number 2, young uncontrolled diabetic patient, COVID-19 patient, patient on high steroid therapy or immunosuppressive drugs or neutropenic status. Antibiotic therapy has no role with mucormycosis, beta. Now, mucormycosis, everybody say black, black, black. Yes, late stage is black nose, black eye, etc. But NEET PG asks early stage, beta. In early stage, maxilla is full of mucor, so cheek redness, cheek pain, eye swelling, blurring of vision, and loss of upper teeth is the classical symptom of early stage of mucormycosis. Best investigation of mucormycosis, beta. Don't write nasal swab for fungal smear. It's of no value. The best diagnostic investigation is biopsy. And in biopsy, if you see septate hyphae, it's aspergillus. If you say aseptate hyphae, it's mucormycosis, beta. And if you do MRI with contrast, you see black turbinate sign. The treatment of choice is liposomal amphotericin B plus debridement also, beta. Plus debridement also, beta. Okay, well, fine. Debridement also. Okay. So that is what the mucormycosis, beta. I hope this session helped you, bache. Eagle syndrome is long started process touching the ninth nerve, causing throat pain referred to ear. Long started process touching ninth nerve, causing throat pain referred to ear is Eagle syndrome, beta. Okay, fine. Now, pinna develop from 2 arch, beta. First arch, second arch, beta. Last time question, tragus from first arch, rest of pinna from second arch. And if this union is incomplete, there will be a hole in front of pinna called pre-auricular sinus, beta. Pre-auricular sinus, you do non-fusion of first and second branchial arch, beta. What is Furstenberg test, beta? Furstenberg test. All of you look at me, beta. Whenever there is a nasal mass over here in a child, it can be simple dermoid, it can be the encephalocele, or it can be glioma, beta. Glioma. So let us think about the encephalocele versus glioma. What is glioma? Glioma is encephalocele, herniation of brain only, but its connection with brain has fibrosed, beta. Its connection with the brain has fibrosed. So there is a swelling over here, mass over here. It's a herniation of brain only. But when we call it glioma, when the connection of this with the brain has fibrosed, beta. So in encephalocele, there's a direct communication between brain and this mass. So whenever the child cries or coughs, this swelling increases in size, beta. Okay, this is called Furstenberg test positive. But if it is a glioma, the connection with brain has disappeared or fibrosed on crying or coughing of the baby, thus there will be no change in the size of swelling. It's called Furstenberg test negative. So Furstenberg test positive is a feature of nasal encephalocele. Furstenberg test negative is a feature of nasal glioma. Nasal glioma, beta. Okay, fine. Next, everybody, please see, beta. Please see, everybody. What is 𝗙cie operation, beta? 𝗙cie operation is done for bilateral abductor palsy of vocal cord. Now, posterior 1/3 of vocal cord is made of arytenoid, beta. Now, 𝗙cie operation is done for bilateral abductor palsy of vocal cord. Means both cord are closed. So, if you cut the membranous part of vocal cord from the cartilaginous part with carbon dioxide laser, the vocal cord will fall backward. The airway will open, beta. In bilateral abductor paralysis, both cord are in the midline. You want to make some space for the air to go to lungs. If you put a cut over here, From membranous part, you cut from the cartilaginous part. What will happen, beta? What will happen? The membranous part of the vocal cord will fall backward. Air will start going to the lungs, beta. So 𝗗𝗏 operation is separation of membranous and cartilaginous part of vocal cord using CO2 laser. It is done for bilateral abductor palsy. Dr. Laman, I put a, like complete topic of cancer larynx in the YouTube only. You can see my channel actually. Okay, fine. Fine over there. Well, this is doing. Chalo. Anything? What is Prussic space, beta? Prussic space is part of epitympanum or attic, beta. Epitympanum or attic. Now, Prussic space is the space where the cholestoma is most commonly found. So, cholestoma is most commonly found in the epitympanum, also called attic. But out of epitympanum, the most common site is Prussic space, beta. So, most common site of cholestoma is Prussic space in epitympanum. It is a space between pars flaccida and the neck of the malleus. What is pars flaccida? Upper part of tympanic membrane. Behind that is malleus there. The space between pars flaccida and the neck of the malleus is called Prussic space. If edema is not given in nasal bone fracture question, don't assume edema. If no edema mentioned, don't think edema is there. Mark the immediate reduction. Okay. Pharmacology in ENT is about that question. But rhinitis medicamentosa is due to a prolonged use of topical decongestant drops like xylometazoline or oxymetazoline. Rhinitis medicamentosa. Okay, fine. Now that is what I can tell you in pharmacology. That can be asked better. Now, I think I can take this one, the facial nerve, the Lebanese segment. Then this is the horizontal segment or tympanic segment. And this is the vertical segment or mastoid segment. And this is the stylomastoid foramen. And this is the internal auditory canal. Brain is here, beta. So this is the facial nerve entry for the brain side. This is traveling through the bony canal and goes to face after coming out to stylomastoid foramen, beta. Now this is called first genu. This is called second genu, beta. First genu, second genu, beta. Genu, no janu, beta. Exam to koi janu vanu nahi, sirf genu. First genu, second genu. Now, first genu contains geniculate ganglion of facial nerve. Very famous question of virology. What is the site of viral reactivation in herpes zoster oticus or Ramsay syndrome? Is geniculate ganglion. In Ramsay syndrome, where the varicella zoster virus got reactivated in the facial nerve, geniculate ganglion. Now, from first genu, we have got one nerve called greater superficial petrosal nerve for the tear gland, lacrimal gland. From the second genu, we have got the nerve to stapedius for stapedial reflex, beta. And from the third one, chorda tympani for taste, beta, taste. Now they ask you how to find the site of injury, beta. Very simple. If the facial nerve got damaged, but look at me, beta. Brain is there, beta. Brain is here. Nerve coming from brain side, beta. By chance, if taste is normal, beta. If taste is normal, write down, beta, write down. Up to the level. Test is normal. Now the three tests, beta. One is the lacrimation test. Next, number two test is stability reflex. Number three test is taste. If taste is normal, it means the injury has happened after the origin of the chorda tympani nerve. So the level of injury will be stylomastoid foramen, beta. Up to the level. Tests are normal. Nerve is normal. Can you imagine if all three tests, lacrimation, gone. Schirmer's test is not negative. The stability reflex is absent. Taste is absent. Then injury must have happened in the geniculate ganglion area, beta. Up to the level test is normal, nerve is normal, beta. The three tests, Schirmer's test for branch number 1, it's a test for lacrimation. For branch number 2, the stability reflex. For branch number 3, chorda tympani, taste. If all these three tests are abnormal, it means the injury must have happened at geniculate ganglion, beta. If all these three tests are normal, then injury must have happened at stylomastoid foramen area, beta. We'll find. In puberphonia, androphonia, in puberphonia, we do what, beta? We do type 3 thoroplasty. The best meaning of type 3 is the loosening of vocal cord. The incorrect name also uses shortening. Shortening is incorrect name, beta. But the correct word is loosening. But for academic purposes, remember both, beta. Loosening or shortening. Why shortening, beta? जब आप किसी चीज को लूज करते हो ऐसे तो देखने में छोटी लगती है, बेटा. ऐसे लूज कर दिया देखने में छोटा लगता है, shortening. And for androphonia, we do type 4 thoroplasty, surgical lengthening or tightening of the vocal cord. Surgical lengthening or tightening of vocal cord. OSMF beta, OSMF beta, oral submucous fibrosis. Whenever you see white palate in a tobacco chewer or a betel nut or areca nut, supari chewer, white palate is oral submucous fibrosis beta. White palate, oral submucous fibrosis patient beta. This is a pre-malignant condition of oral cavity. Don't forget this picture, beta. This very likely question, the tobacco chewer, the betel nut chewer with the white palate, it's oral submucous fibrosis. Patient has trismus. So tobacco chewer with the trismus, with burning in the mouth, with white palate is oral submucous fibrosis. It's a pre-malignant condition, beta. Flat tympanogram is a feature of glue ear or otitis media with effusion. Beta. Flat tympanogram is a feature of glue ear or otitis media with effusion. Okay, beta, fine. In which ENT condition is biopsy is contraindicated? Number one, angiofibroma, and number two, glomus tumor. Beta. Okay, beta, angiofibroma and glomus tumor. Beta. Okay, fine. Okay. I hope this makes sense for everyone. Okay. So this session was about mainly clearing the doubts for everyone. And if there is no phonesthenia is weakness of the thyroretinoid and interretinoid muscle, and that is actually leading to keyhole glottis beta. As myasthenia, myasthenia, muscular weak. Phonesthenia, weakness of vocal cord muscle. When vocal cord muscle are weak, the cord cannot close fully. There's some gap there. The gap looks like keyhole. So keyhole glottis is a feature of phonesthenia beta. Chance of malignancy in leukoplegia, nobody can predict it. Every case is individualized better. There's no chance like that. Every case is genetically, being determined. So guys, if there any other question, most welcome. Otherwise, I would just remind you one more thing at this moment. The last part of preparation is the most important part of preparation. This was supposed to be high intense, academic. I wanted you to clarify your doubts, anything in your mind, so that you know what to mark as the final answer. And do not really panic in the last couple of days, beta. पूरा किसी को नहीं आता होता. Remember that. Do the revision of whatever content you've done till now as much as possible. But this is a time when you should be studying at least 12 to 13 hours every day. Out of that, 3 hours approximately or 3.5 hours should be for multiple choice questions only, beta. Okay, to fine. And wish you good luck. And I'll take your leave with this hope, this prayer in my heart that may you achieve your dreams. May you all be blessed with success in the upcoming examination, NEET PG, and then FMG later on the 6th of July. And if you have any doubt, you can always scribble on Instagram or Telegram to me. I'll be happy to respond. For audiogram, you can see another video on our channel, Audiogram Made Easy. Okay. Turban epiglottis is a feature of TB larynx, beta. Turban, TB. Omega epiglottis, laryngomalacia. Turban epiglottis, TB larynx, beta. Okay, fine. We would like to know, are these sessions helping you? Or are they contributing to your clarity of the subjects or not? For the more detailed videos, please guide your juniors to see the complete latest videos better. The previous videos would always be having lack of data. Old notes will be having lack of data. Please guide your juniors to always see the latest content videos with the latest notes actually. That should have keep in mind the trend of the question also. Bache. Chalo. Thank you very much. My best wishes for everyone. Good luck to everyone. Bache. Good luck. Inverted papilloma and JNA, very totally different condition. Very good question, sweetie. Juvenile nasopharyngeal angiofibroma will be young boy, 12 to 18 years. Highly vascular tumor, so profuse epistaxis. But inverted papilloma or Ringett's tumor will be 40 to 50-year male with no profuse epistaxis, but only epistaxis. Okay, epistaxis. So angiofibroma you cannot miss, but a young boy, 12 to 18-year-old boy. Okay, chalo. Thank you very much. Thanks a lot. Thank you very much. Sorry for the technical interruption in between. It was from my side, probably. I'm taking from a hotel, so that's where the problem was there. Chalo, guys. Thanks a lot.